السلام عليكم، أنا موفق حامد من العراق. جيت هنا عن طريق مستشفى مونيبال عن طريق المطار القديم. سويت هنا عملية بمستشفى مونيبال، أجريت عملية زراعة عظم وتنكدت بنجاح.
Ibrahim contacted us early last year through video consultation. The diagnosis was already made. He had neurofibroma type 1 and he had a congenital deformity on the left side of his face. So he was called for an in-person consultation at Manipal Hospital, and then we decided on doing a two-stage procedure. The first stage involved debulking the tumor from the eye socket on the left side as well as on the intracranial side, that is on the around the brain. Then we had to reconstruct the bone because it's already eroded with the tumor.
The tumor was locally aggressive. It was involving the roof of the orbit and the supraorbital fissure and entering into the base of the skull. It was adherent to the temporal dura, and small bit of enhancement was also seen going up to the dura of the cavernous sinus. This part of the tumor was accessed through a cranial craniotomy. That is, we removed a region of the bone just behind the eyes and then accessed this tumor from above. The tumor was debulked and gross total excision of the tumor was done in conjunction with the intraorbital part of the tumor, which was handled by the ophthalmologist.
Then after the debulking of the tumor, we placed an implant which is called as patient-specific implant. So this patient-specific implant is actually customized implant which is made for the patient itself using the data that is given by the CT scans performed before the surgery. So after the tumor was removed, we implanted this 3D printed implants into the patient so that we can reconstruct the left eye socket as well as the part of the skull that had to be removed. Further going forward, after about 3 to 4 months later, we are going to do a eyelid surgery to correct his droopy eyelid, which will make it more or less symmetrical. But there are limitations to these things, and all these limitations were discussed with the patient, and patient was satisfied with the end result.
الحمد لله فضلهم نجحت العملية وتنكدت بنجاح، والحمد لله أشكر الدكتور راجوج وأشكر مستشفى مونيبال شارع المطار القديم وأشكر الدكاترة بفضل الله نجحت العملية.
This is a very complex surgery. So this involved multi-disciplinary management with the neurosurgeon, the oculoplastic surgeon, as well as the anesthesia team. And this surgery lasted about 12 hours, which indicates the complexity of the case. And very few centers in India as well as the world perform this kind of complex surgeries.